Good morning. I'm just a few minutes early, so I'm going to wait for some people to join us. We're starting at 9 o'clock on this Sunday morning, so I hope it's not too early. Just grab a cup of tea or maybe a coffee and enjoy the next hour or so to learn all about yoga therapy for basically childhood trauma, which is very interesting because I think a lot of us don't even realize that we had childhood trauma. We just did the best we could. We just plugged along and made it happen for ourselves. But one of the really interesting things for me was last year we were in our Yoga for Mental Health training program. It's a 7-month training program that has 2 modules in person and then the rest is online. And when we started going over this material of childhood trauma, we probably had 25 people in the room. And what happened was, as we went through the material and really looked at what childhood trauma is and what are the ramifications of childhood trauma, many people in the room actually had a really, I would say, interesting reaction to the realization that they too had childhood trauma. Here they had come to the training to learn how to help other people with their trauma, but when we started checking off, what does this really mean? What is it about? They were like, oh my gosh, we use this thing called the Adverse Childhood Experience Score, which is an ACE score, and I'll talk a little bit about that in a few minutes. But basically, the higher your ACE score, the more health problems mentally and physically you'll probably have later in life. So we're going through our checklist of ACE scores, and many people in the room had a 7, 8, or 9 out of 10, which was very shocking to them. It was shocking because it helped them understand why they are like they are. It gave them permission to be who they wanted to be. It provided some awareness about why life may have been difficult in some areas for them. And it was just a really eye-opening experience for all of us to understand how much childhood experiences really do impact who we are today in this world, specifically how it is that we relate to other people. What are our fears? What are our attachments? What are our aversions? We know these as the kleshas in yoga, the causes of suffering. And also, when you have those unconscious things happening from inside out, how does that impact your perception of the world? In yoga, we say that each person's perception is completely different because of who they are, and that our perception is actually filtered through us, and that everything we see in the world is basically a matter of the lenses that we have on inside of ourselves. So perception matters. And then from our perception, how do we communicate? And this is huge when it comes to relationships. So some of you know that I study mainly in the Krishnamacharya tradition, and Mr. Deskachar used to say that healing really happens on the level of personality. That when you can heal yourself enough to be in relationships with people and perceive correctly and communicate well and all of those things, now you know you've really healed your childhood trauma. So I just kind of want to start there. There's a wonderful researcher named Sonia Lupien, and I put all of these links in the little chat box here. This is the order that I'm going to talk about them in. First Sonia Lupien, and then Anda and Faletti with adverse childhood experiences. I gave you some great links to the adverse childhood experience material here, and then I tell you a little bit about our optimal state mental health and yoga training program. So all the links you'll need are in the sidebar here. So I want to start with this fascinating research by a Canadian researcher named Sonia Lupien and colleagues. And she is an amazing woman. And basically what she has come up with through her research, and she's Canadian, by the way, is that some people may be more vulnerable to chronic stress based on what happened to them earlier in life. So something got reconfigured at a particular point in life, which causes them to react differently to stress at age 30, 45, 50, 60, right? So her model that she uses is called the life cycle model of stress. And she argues that at any given time in your development, and this could be all the way back to in the womb, because remember, when you're in the womb, within the first few months, you already have a little spinal cord. You already have a little nervous system developing around that little spinal cord. And around the nervous system, not too long after, your endocrine glands are all lumped right around that spinal cord. So very, very, very early in conception, even in a mother's womb, the mother's cells are starting to build the cells of the child. And so we would say that your nervous system and your endocrine system are being built very, very early on in the pregnancy. And you can imagine if your mother was under a lot of stress for any reason, how she's coping and how she's dealing with her own nervous system is then feeding how the baby's nervous system is going to develop. So imagine that you're in the womb, things are not going well, your mother's under a tremendous amount of stress for whatever reason. Your nervous system is going to react differently to the world and respond differently to the world than somebody who had a totally stress-free time in the womb and there was no problems and mom was happy and cared for and all of this stuff. That nervous system is going to be configured a little bit differently. So Lupien goes on to say that not just in the womb, but also, between ages 0 and 2, 2 to 5, 7 to 9, 9 to 14, like all these different stages of life, that a particular brain area is developing at any one of those ages. So she says that if you have, say, a very, very stressful period before the age of 2, there is going to be changes in your little 2-year-old brain that are happening, and that part of the brain that should be developing during ages 0 to 2 is actually going to be slowed down or even stopped from its normal development. So it doesn't necessarily mean that it's, all the neurons died. It just means that the period of growth and how much it flourished. I mean, imagine a plant that can grow a few little buds versus really flourishing. It's just saying that flourishing stops at that period of crisis. So she's looking at things like the fact that there's interaction of genes, there's stress hormones that are being pumped through the child, the length of this exposure to the stress hormones. Was it from 2 to 14 or was it from 2 to 3? Did your mother get you out of the house and find a new life after 3 and then things were fine? Or did she stay in the house that was very stressful from 2 to 14, right? So the length of time that you're exposed, chronic exposure to these stress hormones matters. And the intensity of the stress hormones in the child as well as the mother. Was it super, super stressful, like for a period of a week, and then it was fine? Or was it that you had a kind of a low level, low gradient of stress for 20 years until you left the house? All of these things are going to impact how your nervous system processes stress today, how you perceive the world, and how you communicate in the world. So Lupien is going on to theorize that things like chronic pain, autoimmune disease, endocrine system disorder, nervous system disorder are basically a consequence or a later result from exposure to high levels of stress in early childhood. Fascinating research, and yoga and yoga therapy, as most of you know, and we'll get to a big chunk of this in the talk, we can go in and start working with the nervous system and balancing it out. And the nervous system is very connected to things like fascia. So we can start to change skeletal muscular ways of operating in the world. The nervous system is connected to your endocrine system. So we can go in through the nervous system and start working with your endocrine system. Same thing, with your digestive system. So we have a lot of ways in yoga through the door of the nervous system to impact a lot of other systems in the body and getting them to function as well as they can possibly function. So I just want to read some of a quote from Lupien. She says, if a child is exposed to an adverse experience between birth and 2 years of age, that's when the hippocampus is developing, and it may delay the development of that hippocampus. Giving someone a smaller hippocampal volume in adulthood. So the ability of the hippocampus to function is going to be changed during childhood, which has an impact on your adulthood hippocampal volume. She goes on to say, the frontal lobe, or the prefrontal cortex, starts to develop around 8 years of age, 8 to 14. So again, any kind of adverse experience during that time, a serious adverse experience, could impact how the frontal lobe develops, not to mention your nervous system, your endocrine system, your digestive system, your fascia, right? And she goes on to say, this kind of vulnerability model may explain many of the discrepancies we see with people who have chronic stress, that some people can handle stress really well, some people cannot tolerate any kind of stress, that basically the functioning of their brain and their nervous system was permanently impacted through that childhood trauma. For example, Lupien is doing research at the University of Montreal, and she thinks that she's finding, and this is ongoing research, as you guys know, that people with fibromyalgia actually have a larger amygdala. An amygdala is that place deep inside your brain that creates the fear response. So you can imagine if you have a permanently larger amygdala and you're just getting fear, 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 come on, turn on, let's go, there's fear, let's fear, fear, fear. If that's happening for long periods of time in your life, say decades, imagine how that could contribute to chronic pain like fibromyalgia. So basically what she's saying is that the person with this larger amygdala is chronically frightened and scanning the environment for the next threat, and that has a very anxiety-evoking effect, emotionally upsetting effect, and basically that is a permanent structure in the brain that's functioning differently than some other person. So I just think this is really, really exciting research. She goes into, I have a workshop on childhood experience, and she goes, adverse childhood experiences and early childhood trauma. And Lupien talks about how the hippocampus changes, how the amygdala changes, how the frontal lobes change, how the hypothalamus changes, how the pituitary gland changes, which is the master gland in the body that directs all the other organs and endocrine glands, how the adrenal cortex is changed. I mean, she really has it mapped out here. So I'm just fascinated by her research and wanted to share some of that with you because I think it's really, really important for us to understand why people are the way they are. Meaning, yes, this person reacts differently to stress than this person. It's not all in their head. It actually is something that's changed in their brain and in their nervous system. And again, towards the end of this talk, we'll talk about how yoga and yoga therapy can go in and help to improve the functioning of the autonomic nervous system. That's what yoga and yoga therapy are really, really good at. So that's why I think so many people with trauma are attracted to yoga and yoga therapy, because just doing yoga and yoga therapy tends to have a very healing effect on their nervous system and therefore the functioning of many other systems in their body. So one other thing I want to talk about before we get into that is this research by Robert Anda, ANDA, and Vincent Felitti, Felitti. And they have been working in San Diego for about 30 years with a collaborative effort between Kaiser Permanente Hospital System and the Centers for Disease Control. And what they've been working on is something called adverse childhood experiences and how that affects your well-being as an adult, how it affects the disease pathology that tends to develop in your body, and ultimately premature death. So what's interesting to me is he has got over 86 publications on this. He has been researching it for 25 to 30 years. He is showing amazing data that trauma and adverse childhood experiences actually impacts not only your mental health, but also your physical health. I mean, he has amazing research to support this, and yet our public health system is not yet jumping on board with this. Shouldn't there be an ACE screening in every single doctor's office across the country, in every single psychologist's office all over the country? In our yoga therapy trainings, we take a good look at these ACE findings just to inform ourselves about how childhood trauma can impact the functioning of the nervous system and therefore how we work with people. We do not give people an ACE certificate to do the ACE screening test, but I tell people I think it's like a 25-hour training. There's a few levels you can do. It's very easy to find them online and get trained if you really want to be an ACE screener and do it formally. We don't go that far. We don't spend 25 hours in our yoga therapy training, but we take a really good look at what the research is showing us in terms of mental health and physical health, just so we can be informed and about how yoga and yoga therapy can help people. And in my mind, it's something that basically is a very, very tangible way for us to see that, yes, what happened in childhood is impacting us today. There's no doubt about that. We have the research to support that. And that yoga and yoga therapy can kind of go in and help reprogram. I don't think we can always completely heal adverse childhood experiences, but I think we can do a lot. So one of the very interesting things about adverse childhood experience research, and this is the bottom line with it, he says that most of our health problems are the result of unconsciously trying to resolve our childhood issues. So I'm going to say that again. Most of our health problems are unconscious attempts at solutions to work through our childhood trauma. So basically, if you're smoking pot or cigarettes, if you're drinking, if you're over-exercising, if you're overeating, like all of these things that we do, he's saying are coping mechanisms to try to resolve the early childhood pain. And so when you try to rip away someone's coping mechanism and say, you better stop smoking, you better stop drinking, you better stop eating, so much, you're actually taking away their coping mechanism and they still haven't resolved their early childhood trauma. So that's the kind of thing I want yoga teachers and yoga therapists to understand, that the goal is not to take away the coping mechanism and think, okay, I've done my job, we're all good. You've just done harm to that person. The goal is to help them heal what was lost as a child. And again, we would always do this with psychotherapists involved. We have a team of people, not just yoga people. Yoga people are good at helping to reformat and reprogram the nervous system, but that's not a substitute for talk therapy and having an actual psychologist or medical doctor hold the case for us. I think we as yoga and yoga therapists, yoga teachers and yoga therapists, we have a very special skill set that they don't have, and vice versa. So we need to work together. Another thing that Felitti says about these unconscious solutions or attempted solutions, coping mechanisms, is that they happen most when whatever happened to you as a child was concealed by shame, by secrecy, nobody in the family would talk about it. Maybe there was social taboo against talking about it. And maybe you went to your mom and said, Mom, this is happening to me. And your mom said, you better never talk about that again. We don't talk about that in our family. And you got the message like, okay, got to keep that one quiet. So when there's shame and secrecy and social taboo against talking about what's really happening in these child's lives, that's when these health problems tend to come up, because it's an unconscious attempted solution. So I'm sure you're getting that by now. So one of the big things that happens when your medical doctor asks you the 10 questions on the ACE screening mechanism, people feel like, oh, I've never told anybody in my life about this early childhood experience, but it's my doctor or it's my psychologist, and they have, ethics against telling anyone, so I can tell this person. And just by uncovering it and being willing to talk about what happens, that's the important thing, according to Anda and Felidi, that once you get it out in the open and you start being able to talk about it, that's when your whole brain and nervous system and all the other related systems can actually start their healing process. So what we like to do in yoga and yoga therapy is prepare the autonomic nervous system for this unveiling, this ability for them to bring it out into the open and talk about it and get peace with it, instead of just having secrecy and shame and social taboo. So a couple more things I want to say about adverse childhood experiences and the Felidi and Anda work is that, the highest score you could have on the screening is 10. And basically, if you have more than, say, 4, you will probably have, some either mental or physical health problems. So for example, depression. If your ACE score is, higher than a 4, your chances of depression, especially if you're a woman, he's found, go up huge, significantly. I mean, an amazing amount. Also, anything over a 4 makes the attempted suicides rate much, much higher. So a 3, not so much, but as soon as you get to a 4 out of 10, you're going to have a much higher chance of attempted suicide. Also, he shows data on your ACE score and the rates of prescriptions for antidepressants 50 years later. So you had the childhood experience, when you were 4, and now you're 54, and we're studying you at the doctor's office, and he can show huge increase in the rate of antidepressants if your ACE score is above a 4 or a 5. Hallucinations, yes. Abuse on drugs and alcohol, yes. Antipsychotic prescriptions, again, anything over a 4 is going to increase those risks. Another one he studied is having 50 or more sexual partners, much more likely once your ACE score is 4 or higher. Then he goes into smoking and the effects ultimately of COPD. He can show that ACE scores are linked to heart disease, right? He can, it's just amazing. He can show that they are indicators of work performance. So I would highly recommend that you look into the whole ACE literature, but I kind of want to switch directions and see if we have any comments. I don't know if I can see the comments. Sometimes they hide them from me when I'm, let's see here. Looks like I'm not able to see them while I'm live, unfortunately. I would love to see your comments. Feel free to write them. All right, well, maybe they'll come up soon. All right, so the next thing that I wanted to talk about with respect to all of this is, how does yoga and or yoga therapy help to kind of what I call rebalance the autonomic nervous system? So a big part of what we're doing in yoga and yoga therapy is we are looking at how does your sympathetic arm of your nervous system work and how does the parasympathetic arm of your autonomic nervous system work. And what is supposed to happen is that we're supposed to be going through life in the parasympathetic nervous system, what I'm going to call the PNS. And we call this the rest and digest part of your nervous system. If you're in parasympathetic nervous system, you're not going to be jumping every time you hear a door close. You're not going to be reactive in terms of your emotional response and your communication response. Your perception of reality is going to be very different if you're operating from your parasympathetic nervous system. So just perception, communication, how you feel inside your own body. If you're living in your parasympathetic nervous system, your life is going to be very, very different than if you're in the SNS or the sympathetic nervous system. So what is supposed to happen is that we're in the parasympathetic nervous system until there's a little challenge or a little crisis or a little something that we need to get up for. And then we jump into sympathetic to take care of that. And then hopefully we can get out of sympathetic and get back down. So this is not to say the sympathetic arm of the nervous system is a bad arm of the nervous system. It's necessary. It gets us up in the morning. It helps us give public talks. It helps us go running, right? We don't want to paint the sympathetic nervous system arm as the bad one. It's just that we want to use it appropriately. We want to get up, give the talk, get back down. So for me, after this talk today, excuse me, I'm going to do a yoga nidra to bring myself back down into parasympathetic so that I can be there the rest of the day and not carry on to this, that's happening with this talk. So that's how it's supposed to work. PNS, SNS, PNS, right? But that's not how most of us are functioning. Most of us have insomnia, which means we're in sympathetic all night long. We get up in the morning, we're exhausted, but we decide, I have a lot to do today, so I'm going to have 2 cups of coffee to push myself into sympathetic so I can get some stuff done today. You go out and stress your system trying to get stuff done. Do you see how you're like stuck in the sympathetic? And then after many hours of this, you crash and basically have to rest. Your body will not let you go on. So as we were talking about earlier with the work of Sonia Lupien and Filiti and Anda, if you've had childhood trauma, you may be stuck in the sympathetic all the time because your little brain and nervous system have never come out of sympathetic. They don't even know how to come out of sympathetic to get down into the PNS where you're supposed to be living. So instead of being in sympathetic 5% of the time or 3% of the time or 1% of the time, you're in it 99% of the time, changing your perception of the world, changing your communication, changing your relationships, and a whole lot of other things, your mental health, your physical health. When you stay in sympathetic nervous system for decades, you can only imagine how that would increase your chance for chronic pain or fibromyalgia or heart disease or diabetes or obesity. It is a no-brainer. Lupien and Filiti's work seem like they're cutting edge and oh my gosh, this is amazing. But to us as yoga people, it's common sense. They've been talking about this in yoga since the beginning of time. We know this. So one of the big things that yoga and yoga therapy can help people to do is come out of the sympathetic, relearn what it feels like to be in the parasympathetic, and teach people how to bring themselves down into the parasympathetic. What do the sensations feel like in my body? Starting to learn to differentiate between, there's really nothing stressful happening, but I'm in sympathetic for some reason. Why is that? Is there anything I can do about that? So I have this happen, I wouldn't say quite often, but often enough that I know better, that I won't have anything to eat in the morning and I'll have a cup of coffee and I'll be sitting here working, feeling completely anxiety ridden and sympathetic nervous system turned on. And I'll be like, why am I feeling like this? There's nothing happening. There's no tiger. There's nothing crazy happening. And yet I feel so stressed out. And then I'll remember, oh, you just drank a big cup of coffee, turning you into, turning on the sympathetic nervous system, and you haven't had anything to eat today. You're jumping into work like a crazy woman, right? So how do I back myself off? Okay, I don't want this. I'm going to go discharge it with a little workout, and then I'm going to eat a nice solid breakfast, and then I'm going to come back to work and see if I can't approach my work from an attitude of parasympathetic, like there's enough time, there's enough energy, I'll get done what I get done, breathing deeply, going for little walks, these types of things. That's what we mean by yoga therapy is training somebody almost like lifestyle habits or lifestyle medicine on how to get out of living in the sympathetic and bring it down into parasympathetic. That's what we do on a one-on-one basis with yoga therapy. We take an intake, we do an assessment, we look at all your lifestyle habits, we look at many, many different things. And then we decide what's the best course of action to help you figure out how to live in this parasympathetic and only once in a while go up into the sympathetic, right? That's basically what a good yoga therapist is doing. But in group yoga class, it can also happen. All of us came into yoga and had this experience in group yoga class of bringing ourselves down into the parasympathetic and feeling completely different. Like, whoa, what just happened to me in this hour? Because we were stuck in the sympathetic. And then when we finally did a great yoga class and came down, we're like, whoa, this is good stuff. So it can happen in group yoga class too. The thing that I think yoga therapy goes a little deeper with is this this lifestyle medicine, where we can look at your specific habits, your patterns, your ways of communicating, reacting, your way of seeing the world, and find some lifestyle changes that can help you be more likely to stay in your parasympathetic nervous system. So one last thing I want to say about that is that, again, the sympathetic is not the bad guy. You need both. But what you need to be able to do is get into sympathetic when you need to and get back out. And that goes into this whole new body of research around the vagus nerve, heart rate variability. All of these types of new research are showing what it is that we do in yoga. That basically if your vagal nerve tone is very high, you'll be able to get into sympathetic, achieve your goal, get back out, and come back down into parasympathetic nervous system. That's essentially what high vagal tone means, as opposed to staying stuck in that sympathetic. So, when I look at what does all of this mean in a nutshell, what it means is the structure of your brain or even your nervous system may not change. It might. I mean, there's even research being done showing that actually the neurological changes are actually happening. But let's say that they aren't. Let's put that body of research to the side and just say maybe that there's not physical changes in your brain. Even with that, yoga and yoga therapy can help your autonomic nervous system become more balanced. It can teach you how to use your sympathetic nervous system correctly, how to get out, how to be in your parasympathetic nervous system and set up a lifestyle where you're living in parasympathetic. And as a result, your perception changes. Excuse me. I should have brought some water. Your perception changes and your whole lifestyle has to change, right? Figuring out which things in your lifestyle are putting you in sympathetic and which things in your lifestyle are bringing you down into parasympathetic. So that's really what we do in yoga therapy. Excuse me. So one of the last things that I want to say, just to convince you that yoga and yoga therapy are a huge answer to dealing with childhood trauma. And again, this is in combination with a medical doctor or a psychologist. We're not doing it all on our own. We're complementary medicine that just happens to specialize in autonomic nervous system regulation. That's what we do. That's a fancy name for a yoga therapist. Oh, I regulate your autonomic nervous system through lifestyle change, through breathing techniques, through postures, through meditation, etc., right? We're autonomic nervous system experts. We know that if you can get your autonomic nervous system in balance, it regulates your attentional focus. It regulates your response to pain, especially chronic pain. Not just regulates it, but also changes your perception of chronic pain. It is very connected to the immune system, as in autoimmune disorders. It's very connected to the endocrine system, right? As in fertility issues, as well as many other, hypothyroid, these types of things. The autonomic nervous system is connected to your digestion, if you're having diarrhea or constipation, very, very connected to your ANS, and your sexual functioning. So there is a lot going on here that if we can help find ways to regulate your autonomic nervous system, if we can help ways to do that, look at all the different systems we can have an effect on and get them to function at a more effective and efficient way of functioning. So to me, that's just really, really exciting. I think there will come a day, and I don't think it's very long from now, by the way, there will come a day where Western medical and Western psychology will understand the importance of things like breathing and yoga therapy on mental and physical health. I think they do to some degree, but they think of it as stretching. They don't understand that through certain techniques, like I said, breathing techniques, we actually can go in and tweak the nervous system and teach the nervous system how to have a new way of functioning, more of a parasympathetic way of functioning, and just coming up into sympathetic, for the times that we actually need to, instead of all the time, because we don't have any other choice and we don't know how to get out. So I gave a talk on anxiety on October 14th. If you want to go back in my Facebook feed, October 9th or 14th, I gave one on anxiety, and I gave about 30 to 35 different things you could do for anxiety. What we're really saying is, here's all the things you can do to reprogram your sympathetic nervous system so it's not in high gear all the time. And then last week, which I think was the 20th or 21st of October, if you go back in my feed, we did a whole Facebook Live on depression and what you can do to help your systems function in a different way so that you're not so depressed all the time, right? So both of those, kind of play off this too, because we know with early childhood trauma, that's going to jack up your probability of having anxiety or depression or both, right? So I really wish I could see the comments. It's just not allowing me to, unfortunately. If I could see the comments, we would have a lot more to talk about together, but it's not doing that. So anyway, the way I wanted to finish our talk together today, and I'll go back and look at the comments and write you comments when the Facebook Live is over. What I really wanted you to see today is that the research of Sonia Lupien, as well as Anda and Filiti, are showing us how trauma affects the child's nervous system, endocrine system, digestive system, perception of reality, way that they communicate, way that they move in the world, and that through yoga practices, we have a very, very strong way of going in and helping to reprogram the lifestyle, reprogram the perceptions, and reprogram the communication style. Because once you get calm, once you get into your parasympathetic nervous system, you perceive and communicate completely differently and get different reactions, right? So it's not like we're doing talk therapy to convince somebody to have a new perception. We're not doing talk therapy to say, oh, your communication style is too abrupt. That's not what we're doing. The psychologist might be doing that. What we are doing is actually changing the way that their nervous system functions and bringing them into the parasympathetic, which in turn organically from the inside out changes how they perceive, how they communicate in this world. So I just think it's really, really amazing. I'm so happy to have yoga for mental health training. We have a 9-day module in January, just starting in a few months if you'd still like to join us. And then we do case studies online for about 16 weeks. Every Friday we get together and do a case study online together. And then we have a 9-day module in July. So there's 2 9-day modules with case studies in between. And we would love to have you. I put the link in the notes over here on the side. We'd love to have you join us for our training. We still have a few more spots, and I think it's going to be a really, really great time. So you could be a yoga teacher or you could be a yoga therapist. I think the information that we're going to provide will help whether you're teaching group classes or individuals. I think it will really, really help you to basically deal responsibly with mental health issues and teach in a way that's supportive and loving and nurturing and makes the person feel safe. I think that's one of the most important things. So, okay, well, it has been a wonderful morning together. Thank you for joining me, and we will see you soon. Next week, we'll probably be back with another Facebook Live. Thank you.